Okay, so today we're going to talk about fall prevention in your home and in your community. This presentation is brought to you by student physical therapists from Mercy College. We have Tim Caulfield, Kathleen Delaney, Cody Bello, and Jonathan Rodriguez. So why are we talking to you about this topic? Why is it so important? Well, falls are a lot more common than you think. Falls are the most common cause of injuries and hospital admissions for people over 65 and older. That is very significant. 3.7 million adults report having a fall each year, which we hope that that number shows you that this is a serious topic and this is something that you should try to really pay attention to, because you can do some simple things that will make your home a lot safer and decrease your chance of falls. Just for some statistics, 250,000 seniors are hospitalized for hip fractures each year. One hip fracture increases your risks of falling again. So once you fall, this could impact you psychologically. It could affect your quality of life. After you fall, you might be weary of falling again. You might get scared and you might avoid activities that you once enjoyed. This can lead to unhappiness and a lack of independence and ultimately depression. So risks for falling. There's so many risks. There's internal risks and there's external risks. So some of the internal risks are, as we know, as we get older, balance decreases over time. That could be from leg or foot pain. A lot of times, a lot of people have diabetes. Diabetic neuropathy is a symptom. Once you're over the age of 55, your risk goes up. If you had a fall before or a history of falls, that's also going to increase your risk of falling. Weakness in the legs or the hips is a big one. The muscles around in your legs and your hips are so important and crucial for balance, proprioception, and strength. As we get older, eyesight diminishes. It could be, things that are close or things that are far, depth perception, etc., lighting. So all those things is something that can really affect your balance and affect how you are, if you're aware of your surroundings. So problems with eyesight is key. Heart diseases and medications. Medications, you might not be yourself on them. They also can make you dizzy, etc. So external risk factors. These are the ones that we're going to talk about, and these are the ones that we're really going to try to address. So external risk factors. It could be medications again. It could be a toilet seat or a couch that's too low. That's going to be very difficult for you to get out of eventually. Maybe not right now, but it could be at one time. So if you don't have handrails where they're needed, maybe stairs. Area rugs are a big one. Area rugs move if they're not tacked down appropriately, or they have something under them to make them stay in place. That's a big risk for falling. A slippery bathtub, or one that's too high, because it might be difficult for you to get your leg over. Like we said, low furniture, not just chairs, but that could be an ottoman that's in the way, or a coffee table that you might not see. Stairs, everybody's stairs are different. The heights are a little different, so that's also something that you might not be used to. Curbs, cracks in the sidewalks, and ultimately just uneven floors. So home modifications. So what we really want you guys to do is to tack down any loose carpets or get rid of them. Clear the clutter away, especially the ones from your grandchildren. You could have toys on the floor, shoes on the floor, etc. Lighting is key. You can't see something, so if you can't see it, you obviously could trip over it very easily. So we have to make sure the lighting is good, especially at entrances and etc. You want to watch for any wires or lines, and you want to have handrails on both sides of the stairs. In addition to the handrails, you definitely want to have some in your toilet or near your tub. Make sure your toilet seat's not too low or too high. And just put grips around and non-skid mats where you can, because the bathroom is very tricky. There's a lot of stuff going on in a tight area, and there's wetness, and it can get very slippery. So all in all, what can you do to prevent falls? You can always talk to your doctor or physical therapist. Everyone's always happy to help out. You can modify your home by using this presentation specifically. You can increase your legs, the strength in your legs, so that will help with your balance and stability. You could be, and then just also make sure that you're always aware of your surroundings and never be afraid to ask for help. Lastly, we have just the recap, just to let you know everything that we talked about. And we do have a handout that has some questions to kind of quiz you on the key parts of our presentation, and also a home modification checklist, and then just um, a few questions about how our presentation was and how we can make it better. Thank you for your time.